Well, hello today. This is Brooks Travis, and I'm here with Melanie Scott. And Melanie Scott can you describe to us, introduce yourself and your company to us,
Oh,
Melanie?
sure, sure. I'm Dr. Melanie Scott. I'm a clinical psychologist, and I have an office in Mission Viejo in California here.
How long has your company been in business?
I've been in business at least since 2009 in private practice, but in terms of the work that I do, I've been doing it since about 2003, and that work has been in counseling and evaluations with people.
And where did you get your education, and when did you graduate from school?
So I got my doctorate degree from the University of Hartford, and I obtained that degree in 2007. And then, as a doctor in psychology, we were required to do training. So my training was at Yale University in the School of Medicine, and I did a 1 year internship at Yale in the Division of Substance Abuse, and then I did a 2 year postdoctoral fellowship in the Yale Division of Law and Psychiatry.
Oh, wonderful. Why did you decide to get into this area? What is your passion in this?
I love helping people. By nature, I'm a helper, so it really naturally fits me. And I'm also pretty inquisitive, and so I like to do evaluation work, which at times can be very tedious in terms of the small details, but that's good for a person like me. I've always just, those are the two areas that have been important to me, so it makes sense.
Now, what is the market area that you serve right now? I guess from a location standpoint, you said you're in Mission Viejo, but do you serve a broader market than that?
I do serve a broader market, so I really serve anyone who's in the Orange County area. But in addition to that, outside of Orange County, kind of the LA area as well, and I go down to San Diego often too. So anyone within that kind of OC and larger metro area is what I work with.
Oh, wonderful. I know in talking to you previously that your practice is pretty broad, but in the area of elder care and um, basically taking care of folks that need assistance when they grow older, what is your typical client in that area?
In terms of typical client, it's anyone who's dealing with grief issues or loss issues or family issues, couples issues. All of those are very relevant to the work that I do. So oftentimes I've had clients who either due to an aging family member have come in for family therapy, or it's a couple and one is having more medical issues or psychological issues that are relevant to aging. So those are often populations that I've worked with.
Sometimes in my practice, I see one client of a long time married couple where one client is slipping a little bit from a mental standpoint. And sometimes that can lead to even some violence to some extent, meaning that they don't really know what they're doing, but they're reacting to what they're feeling.
Yeah.
How do you deal with someone like that?
Yeah, I think you raised some really important issues, and I think those are things that families definitely deal with when that happens. Oftentimes, there's a lot of confusion that comes with that. Dementia can impact that as well. Poor sleep and poor nutrition and other things like that can also impact that. And it's very stressful for a family to deal with and very confusing again. So those are very common issues, and just having support of a therapist is often very helpful and getting some direction in how to work with a family member when this is happening. It can be very painful, especially when you've seen someone at a state when they're functioning so well mentally, and then to then see them having a lot of difficulty can be really hard on a family and cause a lot of tension. So seeing a therapist is helpful so you can talk to someone and get some support.
Now, one of the things with dementia that we have to deal with is the fact that sometimes dementia comes along with ill health, but many times dementia hits when someone is relatively healthy,
Yes.
and that condition can last over a prolonged period of time. Do you have any tips to families as to how to relieve the stress off of maybe one family member and spread the stress at all? Or
Yes, I think exactly what you're saying is number one. Priority is what we always tell people is you can get burned out very easily when it's one family member that's dedicated to doing all of the responsibilities of the family member that's having the difficulty of something like dementia. So you really need a lot of family support, community support. If you have other resources that are available to you, that's really important. That's what we find is the most helpful. It's just that additional level of support.
Mm.
So yes, spreading it out is very helpful. Again, seeing a counselor is very helpful. If you're able to get outside medical resources to come in, that's also something that people find very useful for their families as well.
Oh, wonderful. You know, in doing some documents that we do for people all the time, like the powers of attorney or even incapacity trustees, if there's a great deal of trust and understanding between the persons who are taking care of the elder, sometimes we'll name more than one person to serve, and we'll give each of them independent power to act.
Yeah.
And that allows one to take the place of the other. And but we only recommend that in the cases of a very stable family situation where the children are very much dialed into communicating with one another and that type of thing. So that kind of goes along with what I think you're talking about here. What do you think that you do better than some of your competitors?
Well, I'm very detail oriented, so I think that's very important, especially if a case is complex and it has many aspects to it. So you can just know that I'm very devoted and I pay attention to all of those important things. I've been well trained in what I do. As I said, I have my doctorate degree, and for a psychologist, your training years are the years when you work with patients and you learn how to work with people and do the work that you do for the rest of your career. And I did training in a really good institution at Yale. So I was a faculty member there for about 3 years before I moved here to California. So I think I'm very well trained in that regard around therapy and as well doing the evaluations. And then I care. I really love what I do. I care about what I do, and I love meeting with people. And I like to see, the impact that I do have when a family is able to get through a really difficult time, and they have the support there to assist them.
I think it's obvious from talking to you that you do care greatly. Is there anything else that you'd like to say to the audience?
I guess that, again, these issues are really difficult for families to go through when you have a loved one that's having a lot of difficulties, and it's outside of the norm. Families have roles that they normally fulfill. So certain family members are in those different roles. A father may be considered to be very strong and very intellectual, as well as the mother and the son and the daughter. And when we start to notice that people are having these difficulties and they're suffering and their mental status isn't what it is, it can be extremely difficult for a family to deal with. And it's just important for people to know you have to have support during that time. Oftentimes there's a lot of stigma behind it, and people just don't want to tell people what's going on or seek help for these things. But the best thing you can do is seek help for it. So I just urge people to do that if they're dealing with those issues.
Oh, wonderful. Well, thank you so much for being with us today. I
Thank
really
you.
appreciate it.
Sure.